Hi, I'm Dr. Larry Malerba. Welcome back to the ATH Materia Medica series. Today I'll be talking about Medorrhinum, which is a homeopathic nosode. It's a remedy prepared from a gonorrheal discharge. The primary component of that discharge is Neisseria gonorrhea, which is a gram-negative diplococcal bacterium. It's the infectious agent responsible for cases of gonorrhea. And as we shall see, gonorrhea is the main vector for the psychotic miasm, which produces a predisposition towards certain types of symptoms and illnesses in those affected by this miasm. All right, let's not waste any time. Here we go.
Okay, you may recall that the Thuia Materia Medica episode contains a brief discussion of miasms, and more specifically, the psychotic miasm. The psychotic miasm results from the suppression of gonorrhea through inappropriate medical treatment, and this miasmatic influence can then be transmitted either to a sexual partner or energetically, not genetically, through childbirth to subsequent generations. The main features of the psychotic miasm are psychological self-consciousness and behavioral excesses, general aggravation from damp or cold-damp conditions, a tendency toward benign growths and chronic discharges, and a tendency to develop asthma, sinus problems, and urogenital conditions. Dr. Hahnemann coined the term psychosis using the root psycho from the Greek, which means fig. A figwort is a benign genital growth that looks like a small clump of cauliflower. And Hahnemann determined that figworts are a common manifestation of the psychotic miasm. Common conditions associated with the gonorrhea miasm are benign genitoanal growths and purulent urethral discharges. Now, it's important to realize that Medorrhinum is not well represented in most repertories. The same is true of the other big nosodes, tuberculinum, carcinosin, psorinum, and syphilinum. Since they're not likely to appear near the top of a repertorization, it's important to know their features well and to keep them in mind when taking and analyzing cases. With this in mind, let's talk about Medorrhinum. Now, the tendency toward benign growth serves as a fitting metaphor for a theme that characterizes the essential nature of Medorrhinum, and that theme is exuberance. Medorrhinum is exuberant. Now, let's look for a moment at the definition of that word. Exuberant means a feeling of excitement and eager enjoyment, lively, happy, cheerful, energetic, filled with energy and enthusiasm, joyously unrestrained, something that is produced in extreme abundance, excessive in degree, extravagant, plentiful, growing profusely. Here we see the parallel between exuberance and the psychotic miasm, which involves a predisposition toward the unrestrained production of benign growths like cysts and warts. It has been said that the psychotic miasm produces exuberant flesh. In similar fashion, the Medorrhinum type tends to do everything in excess. He tends to go to extremes. He's often too intense and too passionate for his own good. And he often suffers from the consequences of his excess passion. He is excitable and has a lot of emotional energy. Medorrhinum is always up for fun. He's adventurous and wants to have a good time. He's always out looking for excitement and new experiences to keep himself amused. Most cases that I've seen are extroverted, expressive, enthusiastic, and full of energy. I tend to think of Medorrhinum as the ultimate party animal. That's why it's been referred to as the sex, drugs, and rock and roll remedy. Medorrhinum stays out all night long, experiments with drugs, drinks too much, and readily indulges his sexual cravings. The Medorrhinum libido is usually quite strong, and self-control is often lacking. Not surprisingly, his sexual excesses can often get him into trouble. If I suspect that this remedy is needed, I'll ask patients if they've ever had a party animal phase of life. Many will openly admit to fond memories of their youthful indiscretions. Medorrhinum's strong sexuality can sometimes manifest at an early age. Young children may masturbate, and sometimes there are incestuous impulses. Medorrhinum is commonly indicated for hyperactive children who are wild, fun-loving, and lack impulse control. Even when religiously inclined, the Medorrhinum type has a tendency to go overboard. His religious enthusiasm can border on fanaticism. Now, in addition to the Medorrhinum passion, intensity, and exuberance, we also tend to see a strong sensitivity. Medorrhinum can fit artistic types and lovers of beauty. There's an awareness of the beauty of life and all of its mystery and wonder. There may be a love of nature or a great love of and compassion for animals. He may weep easily and can cry when talking about his problems to the homeopath, and he often feels better after crying. Medorrhinum lists prominently under mind weeping when telling about one's illness, and mind weeping ameliorates. And although most are extroverted, sometimes this Medorrhinum sensitivity can translate into timidity. And while some are animal lovers, the Medorrhinum passion can sometimes spill over into cruelty toward animals. Now, it also makes sense that it would be hard to maintain such high levels of intensity and enthusiasm over a sustained period of time. And that is why another defining feature of the Medorrhinum type is that he lacks consistency or balance. He tends to be quite erratic and unpredictable. Other than his well-known tendency to be a night owl, there's no predictable pattern to his otherwise chaotic surges of passion. Sometimes his eager zest for life lasts for days or weeks at a time. Sometimes he crashes and burns without warning. This inconsistency can apply to both his energy level and to his emotional states. His energy can be high or low, and his mood may be up or down. He can be alternatingly happy, sad, excited, or bored. He can be enthused and ready for action, or indolent and disinterested. He can be sympathetic and compassionate, or self-centered and irritable. The bottom line is that Medorrhinum's energy and exuberance are notoriously erratic and streaky. Another aspect of the Medorrhinum type is that he can be anxious and impatient. He often feels hurried, in a rush. Some describe having a wild feeling in the head. Some repertories list this in the head section, others list it in the mind section. Interestingly, Medorrhinum may complain of having a distorted sense of time. Time tends to move along too slowly. That's why Medorrhinum lists prominently under the rubric "Time passes too slowly." It can also be found under delusion that everything seems unreal and mind as if in a dream. Along with this feeling of unreality, some complain of mental confusion, of being spacey or foggy-headed. They can be forgetful and may complain of weak memory. He can forget words or names. Sometimes he forgets mid-sentence what he was about to say. Medorrhinum is listed prominently in the rubrics mind, forgetfulness for words, mind, forgetfulness for names, and mind forgetfulness for what he is about to say. It's the strongest remedy listed under mind forgetfulness for his own name. Naturally, Medorrhinum's overall erratic nature, his hurriedness, the wild feeling in his head, his sense of time distortion, and his general forgetfulness can occur in different combinations to different degrees depending upon the individual case. Now let's finish the mentals with the Medorrhinum fears. While fear is not a big feature of this remedy, perhaps the most common one is a fear of the dark. Somewhat related to this fear is a fear of things that are lurking under the dark surface of the ocean. Another similar fear and keynote clue for Medorrhinum is a feeling that someone is behind him. He senses that someone is there and turns around to look. Medorrhinum lists prominently under fear that someone is behind him and delusion that someone or something is behind him. There can also be a fear that something bad will happen. And given Medorrhinum's erratic state of mind, it makes sense that there can be a fear of losing one's mind. This may be expressed as a fear of going crazy or a fear of becoming insane. Most of these fears reflect the idea that Medorrhinum has a strong imagination and that he isn't able to fully trust his own mind or perceptions. Okay, now let's discuss generals and modalities. Okay, so for starters, most Medorrhinum cases are decidedly warm-blooded. The feet are hot and they sleep with their feet uncovered. These are the kids, for example, who take their shoes and socks off as soon as they get home from school. And in spite of being warm-blooded, Medorrhinum's symptoms are aggravated by damp weather, especially cold, damp weather. Remember that this aggravation from damp is a distinguishing feature of the psychotic miasm. Furthermore, in spite of being aggravated by dampness, Medorrhinum is ameliorated by being at the ocean. So even though an ocean environment tends to be damp, it does not aggravate his symptoms. He actually feels better from being near the ocean and better from bathing in the ocean. Conditions like asthma and eczema will magically improve while being near the seashore. Many Medorrhinum types will say that they love the ocean and that it is their favorite place to be. Medorrhinum lists prominently under both generalities seashore air ameliorates and generalities bathing or washing in the sea ameliorates. Now, another reliable clue that points to Medorrhinum is that they tend to be late night persons. They love the night. They come alive at night and they feel energized at night. They feel better at night. Sometimes they even stay up all night long. It's important to ask about biorhythm patterns. I routinely ask my patients whether they tend to be more morning, day, or night persons. And I also ask if there's any bad time of day when they may feel tired or grouchy. The information elicited by these questions can be quite helpful. In terms of food likes and dislikes, Medorrhinum can have a specific and notorious craving for oranges or orange juice, and this often generalizes to other similarly sour things, especially when the sour in question is citrus sour. So he likes oranges, grapefruits, and other citrus fruits. He likes fruit before it has fully ripened, during the phase when it tends to be more green. He likes crispy, crunchy, tart apples. I recently found a listing of types of apples rated according to their tartness. The top rated apples are Granny Smith's first, then Pacific Rose, then Macintosh, and then Empires. Medorrhinum also likes the combinations of sweet and sour and salty and sour. He also likes ice and ice cold drinks and alcoholic drinks. So an icy cold tropical drink that is both sweet and citrusy sour can be an ideal drink for the Medorrhinum type. I once saw a young woman who had been diagnosed with a severe case of psoriasis. However, when I examined her skin, they looked more like warts to me. She literally had thousands of warts covering almost her entire body. When I asked about her food desires, she embarrassingly told me about her secret passion. She loved to put unripened green bananas in the freezer. When she had a craving, she would take one out and eat it frozen. To my amazement, the so-called psoriasis completely cleared up within a few months while taking periodic doses of Medorrhinum. Additional Medorrhinum preferences include salty things, fatty foods, and fish. And given his exuberant nature, it's not surprising that Medorrhinum can have frequent cravings for many different things. Now, there's also one specific Medorrhinum food aversion that essentially boils down to an issue of texture. He is averse to slimy things, especially to eggplant and okra. Okay, now an additional important clue is a prior history of gonorrhea in either the patient or a parent. Naturally, this may be a difficult thing to elicit given the general secrecy and shame associated with sexually transmitted conditions. Medorrhinum also has a tendency toward chronicity of symptoms. So when we see a history of gonorrhea in a person with chronic illness, we must think of Medorrhinum. On the other hand, it's not necessary for there to be a history of gonorrhea in order to successfully prescribe this remedy. A few other valuable general clues include an amelioration from discharges, a strong sex drive, a tendency toward nail biting, and the famous Medorrhinum sleep position. Medorrhinum kids tend to sleep in the genupectoral position, with the knees tucked up against the chest. Furthermore, this position can help ameliorate certain symptoms. When asthma symptoms flare up, for example, the Medorrhinum patient may experience relief by getting into the knee-chest position. I've had full-grown adults get down on the floor in my office in order to demonstrate this position to me. All right, now let's talk about Medorrhinum's physical indications. Being a deep-acting nosode, Medorrhinum is a remedy for a very broad range of conditions, especially chronic conditions. We think of this remedy when we see serious chronic disease manifesting at an early age. So when we see juvenile rheumatoid arthritis in a child, for example, we think of Medorrhinum. It may be indicated for heart disease that develops in younger adults. Now, this remedy is often chosen by virtue of its mental profile and the generals and modalities. So for this reason, I'll give just a brief summary of some of the main physical conditions that point to Medorrhinum. Generally speaking, most of Medorrhinum's physical pathology tends to focus on the genitourinary system, the nervous system, the skin and mucous membranes, and the musculoskeletal system. Medorrhinum can be indicated for just about any male or female genitourinary problem that you can think of, especially, as previously stated, when we see a history of gonorrhea or indications of the psychotic miasm. Of course, the books tend to refer to this as a history of suppressed gonorrhea. The reality, though, is that any case of gonorrhea, treated appropriately by conventional medicine or not, is likely to have been suppressed and to have left its mark, or energetic scar, if you will, on the constitution of the individual in question. It's sufficient, therefore, to conclude that any history of gonorrhea is a strong indicator for the psychotic group of remedies, the main nosode of which is Medorrhinum. It may be indicated for cystitis, urethritis, vaginitis, chlamydia, pelvic inflammatory disease, nephritis, or any urinary tract or sexually transmitted infection in women, whether acute or chronic. In men, it may be indicated for either acute or chronic urethritis, orchitis, epididymitis, or prostatitis. It can even be indicated for urethral stricture. It's also a remedy for genital herpes and genital warts. The literature often refers to these benign warty growths related to the psychotic miasm as excrescences. Recall our metaphorical reference to such growths as exuberant flesh. Now, the odor associated with Medorrhinum discharges can sometimes serve as an additional clue. Whether we're talking about a urethral discharge, a vaginal discharge, or even perspiration in general, these discharges are often described as having a fishy smell. Medorrhinum is also a remedy for chronic runny noses in children and postnasal drip in kids or adults. The accumulation of mucus creates a tendency to clear the throat frequently, and it may be associated with a susceptibility to developing either acute or chronic sinusitis. Remember that Medorrhinum discharges tend to ameliorate, and the suppression of those discharges can aggravate. In other words, drugs like antihistamines, antibiotics, and decongestants may clear up a discharge, but this can result in an overall worsening in the state of health of the Medorrhinum type. Other Medorrhinum respiratory conditions include chronic bronchitis and asthma. The coughing, wheezing, or difficulty breathing associated with these conditions tends to be relieved by assuming the genupectoral position and by being in close proximity to the ocean. A few additional specific clues that point to Medorrhinum include sensitivity of the soles of the feet that makes it painful to walk, severe diaper rash in infants, swelling of the ankles, and an unusual type of constipation that is ameliorated by leaning backward in order to be able to pass stool. Medorrhinum is the only remedy listed under rectum constipation, must lean far back to pass stool. And lastly, the main remedy indicated for Reiter's syndrome is Medorrhinum. This is an older term for a condition that is now conventionally referred to as reactive arthritis. It's defined as arthritic inflammation and swelling that develops after an infection somewhere else in the body. The classic triad of Reiter's syndrome is a combination of urethritis, conjunctivitis, and arthritis. So whenever we see arthritis or chronic inflammation associated with either conjunctivitis or a UTI like urethritis, we must consider Medorrhinum. All right, now let's talk about remedy relationships. Okay, remedies complementary to Medorrhinum include Thuja and Natrum sulfuricum. These are the three main representative remedies of the psychotic miasm. Additional complementary remedies include Cannabis indica and Pulsatilla. Remedies worth comparing to Medorrhinum include sulfur, because it's warm-blooded, uncovers the feet in bed, can have a lot of food cravings, and has a brash and forward personality. Lachesis is also a late-night person, is warm-blooded, has a strong sex drive, and feels better from discharges. Nat Sulf also likes crispy tart and green apples and is aggravated from dampness. Calc Sulf also likes sour or unripened fruit, is warm-blooded, and tends to have a strong personality. Phosphorus is happy, fun-loving, likes ice-cold drinks, and can be spacey, confused, and distractible. Nux vomica is similarly intense, passionate, has a strong libido, and can overindulge in food, alcohol, and drugs. Cannabis indica is also a psychotic remedy, is confused and spacey, indulges in mind-altering drugs, and experiences time distortions, as if time is moving too slowly. And last but not least, tuberculinum, which also fits children with behavior issues. We can think of both tuberculinum and medorrhinum as thrill seekers. Both are averse to being bored. The difference is that tuberculinum seeks excitement by flirting with danger. For Medorrhinum, thrill-seeking means having a wild and crazy fun time. While tuberculinum is willful, defiant, and hyper, I tend to think of Medorrhinum as happy, fun-loving, and hyper. And unlike tuberculinum, Medorrhinum is usually not intentionally malicious. It's more accurate to say that when Medorrhinum becomes aggressive, it's because he can't control his passionate emotions and impulses. Okay, that's my perspective on the Medorrhinum picture. Please don't hesitate to ask questions. I always appreciate your feedback and comments. Thanks for watching, and be sure to subscribe. And I hope you'll tune in again to the next episode of All Things Homeopathy. May the vital force be with you.